The first topic of choices we have is rabies. I'm gonna start it over here. So vaccination, the first question comes to my mind is, when do you celebrate World Rabies Day? World Rabies Day, we celebrate it on 28th of September. Okay. We have the topic is vaccination, and we have is that if you have been bitten by a dog, how do you approach this case? Like for example, we have this patient. If you can see this patient, 1 second. Yes. So this was the patient. So this patient has been bitten by a dog. So how should I approach this case if the baby has been bitten by a dog? And there is this child is bleeding also. This patient is bleeding also. So how will you do it? Okay, the patient for the rabies vaccination will tell the patient to go and clean the wound. We have to go and clean the wound with soap and water. So how many minutes should we clean the wound with soap and water? The answer is 10 minutes. We should clean the wound with soap and water for 10 minutes. Okay, I'll repeat again. For rabies vaccination, you need to know the category. There are 3 categories of dog bite or rabies vaccination. We have category 1, category 2, category 3. There are 3 categories of dog bite. What are they? Number 1, if the patient has just licked the area, that is category 1. If the patient has, there's a clean cut, this patient has multiple cuts, but it is without bleeding, will be category 2, and with the bleeding will be category 3. Right? For category 1, nothing, reassurance. Reassurance will be the best management. If your doggy has just licked that area, the joint area, nothing to do. Just reassurance and send the patient home. In a case of category 2 of dog bite, we give something known as ARV. We give something known as ARV. What is ARV? ARV is nothing but anti-rabies vaccine. Anti-rabies vaccine. If the dog has, I have been bitten by a dog, but it's not bleeding, it's category 2. You will give me ARV and TT. ARV and TT. ARV is anti-rabies vaccine and TT is tetanus toxoid. You will give 0.5 ml intramuscular stat. Whereas anti-rabies vaccine also you give intramuscular. Okay, intramuscular. Okay. Next, very important, if you have been bitten by a dog, but you're coming into category 3, in a case of category 3, you will give TT, you will give ARV, and you will give ARS. TT, ARV, and ARS. TT, you will give 0.5 ml. ARV, you will give in, very importantly. So ARV, remember, okay, ARV is given intradermal, whereas ARS is given intramuscular. Doctor, for how many days I should give my baby injection? We have a modified thigh cross regimen. We have a modified thigh cross regimen. And what is that? According to the modified thigh cross regimen, 03728, 4 दिन आपको टीका लगेगा. वो टीका है एंटी रेबीज वैक्सीन का. एक आज लगेगा, एक 30वें दिन लगेगा, एक 7वें दिन लगेगा और एक 28वें दिन लगेगा. 0, 3, 7 and 28 is the dosage you give. Like 4 बार टीका लगता है एंटी रेबीज वैक्सीन का. Intradermal and intramuscular. Anti-rabies vaccine is given dermal. Anti-rabies serum ARS is given intramuscular. Okay. Now this is a good question. Doctor, I have been bitten by a dog last year. Now again I got a dog bite. What to do? Yes, this is a good question. Last year मुझे कुत्ते ने काटा था. मैंने सब दवाइयां, सब टीके लगवाए थे. इस बार कुत्ते ने मुझे फिर काट लिया. Now what to do? अगर हम बात करें तो 3 ऑप्शन आते हैं हमारे कैटेगरी 3 में, TT, ARV एंड ARS. रिमेंबर TT जो है हम 5 साल में एक बार देते हैं. TT इज गिवन वंस इन 5 years, नंबर 1. ARS की अगर हम बात करें, प्लीज रिमेंबर, ARS is given once in lifetime. ARS, anti-rabies serum, is given once in lifetime. And what about ARS? ARS का 03728 या फिर 03730 डोज तो हो गया. अगर मुझे 5 साल के अंदर, विद इन 5 years ऑफ लाइफ, आई वॉज बिटन बाय अ डॉग, मैंने पूरी दवाई दी थी. अगर 5 साल के अंदर मुझे कुत्ते ने काटा था और मैंने दवाई पूरा ट्रीटमेंट लिया था, तो आज मुझे 4 इंजेक्शन नहीं लगेंगे, मुझे सिर्फ और सिर्फ 2 इंजेक्शन लगेंगे, डे 0 एंड डे 3. आज टीका लगेगा मुझे और मुझे कल 30 दिन टीका लगेगा.